Welcome to the Gut Reset Summit. I'm your host, Dr. John Dempster, and I'm thrilled to have a very special guest today, Dr. Keesha Ewers. And Dr. Keesha is board certified in both functional and Ayurvedic medicine, a doctor of sexology, a trauma-informed psychotherapist, family practice advanced registered nurse practitioner with a specialty in integrative medicine, and the founder and medical director of the Academy for Integrative Medicine Health Coach Certification Program. And Keesha has been in the medical field for over 30 years. And after conducting the HURT study in 2013, and the HURT study stands for Healing Unresolved Trauma, she developed the HURT model for understanding how past childhood trauma impacts adult health. And this led to the creation of the Freedom Framework that she used to reverse her own autoimmune disease, and now is used to help hundreds of her own patients to do the same. So welcome, Dr. Keesha. Thanks for being here.
Oh, thanks for having me. It's a delight to do this with you. Thank you.
I know I kind of touched a little bit on your background, but I would love to hear, everyone has a story. I'd love to hear more of your story and how we ended up here.
Yeah, you're right. It's how I start all my interviews too, because it's so fascinating how we get from one side of the fence to the other. So I am definitely no exception. I was a registered nurse in kind of a high intensity intensive care unit, life flight, balloon pump team, scenario in my very early days, in my early 20s. And I was running marathons and skydiving and just kind of an adrenaline junkie. And in that, got married, had 4 children, set out to be the very perfect spouse and the perfect mother, and just drove myself so hard when I look back retrospectively. And right around the age of 30, I got diagnosed with rheumatoid arthritis. It was just like someone had taken the batteries out of the Energizer Bunny. I woke up one morning flattened. I had 10 extra pounds of puffiness and redness all over my joints. I was so exhausted. And when I went in, the physician who I saw asked me if I had any autoimmunity in my family history. And I said, yeah, I think my grandfather had rheumatoid arthritis and was in a wheelchair before he died. And he actually died at the age I am right now, at the age of 58. And she
Wow.
said, well, that's what you have, my dear. And she gave me these 2 prescriptions, off of her pad, one for methotrexate, one for a non-steroidal anti-inflammatory drug, and said, when you get worse, come back and we'll change your meds. And that was it. She was going for the door. And I just remember going, well, wait, is there anything else I could do? I'm very disciplined. I make my own food. I'm very healthy, and my definition of health back then. And she said, no, this is genetic. I'm afraid you've drawn the short end of the straw. And so I remember on my way home thinking, I wonder if there's a different way of looking at that. And, I was fully trained and brought up in a Western medical model. And I always tell my students and patients, like, if an herb had bitten me on the bottom, I wouldn't have known what it was. So I started going online and looking to see in PubMed if there was anything else that I could find. And I found some compelling research on yoga and autoimmunity. So the next day I was in my first yoga class. And as they do, the yoga teacher wandering through the studio, he was telling us a little bit about this framework of medicine from the Vedas called Ayurveda. And he said enough that I thought, well, this is interesting. And I went home and looked it up. And it was as if the clouds parted. I mean, it was really interesting because 5,000 years ago, here's this framework of medicine that's the sister science of yoga that actually says we're all different. And that, instead of matching a series of drugs to a series of symptoms, that there's this way of getting feedback from your body really early. And, that proper digestion is what creates healthy tissue layers. And out of that comes vitality. And, something that I had never been exposed to. And then also, as sort of a sidebar, oh, by the way, autoimmune disease is undigested anger. And it was in that moment that I just remember sitting back in my chair going, you have to digest your emotions and feelings like you do an apple. That was so revolutionary to me. And second thought was, but I'm not an angry person, and then thinking, well, maybe that's a problem that I strap on my running shoes and go for miles. If I'm upset, maybe I'm not digesting. And so it was a really fascinating sort of paradigm shift for me. And I began to practice yoga, learn how to meditate. And over the course of a few weeks, started, in meditation, this word autoimmune kept coming forward. And I thought, gosh, that means I'm attacking myself. And I was thinking this one day in meditation, auto. And
Hmm.
I wonder if there's a time in my life that I wanted to die and gave my cells and genetics this messaging. Now, see, this was a long time ago before we actually know that that's actually what we do now. And, I went, I bet. And so I started going backwards in my memory banks and thinking, is there a place when I wanted to die in my life? Because I certainly didn't now. And yet I was killing myself. And so I thought, And I went back and I found this 10-year-old little girl version of myself who was being sexually abused by the vice principal of my elementary school. And I saw her and I went, oh, you did want off the planet. And you didn't understand, you're confused. Like I didn't have the right languaging to tell my dad was out to sea in the Navy. My mom, I had tried to tell her, but it was more like, I don't feel safe at school, and just didn't have like the wording, the correct wording to tell her or the teachers that I tried to tell. And so I thought, gosh, this confused little girl probably did set up this code cellularly and genetically that it was sort of like having a turkey timer in me. Ping, you're done. And
Hmm.
nowadays we know with the scientific literature that it takes anywhere from 10 to 30 years to develop a full-blown autoimmune disease. And here it was 20 years, at that time period. And I thought, gosh, if I go and heal that, I wonder if it'll affect this 30-year-old body. So I went into some deep trauma work and my RA reversed within about 6 months. And so I thought, gosh, I need to go back to school. I've really got to, this is amazing, like being told that you don't have any control over this, come back when your meds are not working anymore. Like this has got to go. And so I went back and, just started learning this other way of being and working with my patients and reversing their autoimmunity. And that's where I am today. I always say whenever someone's came in my office and stumped the chump went back to school.
Well, look at you. I mean, what a journey. And
Mhm.
thank you for sharing. This is very powerful, and I'm sure it's resonating with a number of listeners right now. And
Yeah.
I mean, it just sounds so familiar to some of the patients we've seen, but you
Yeah.
have that, that ability to start to really tap into this. And that's what this talk obviously is going to be a lot about, is I want to learn more about the childhood trauma and how it can impact so much of our adult disease. And specifically for this talk, gut health, which is such a
Right.
big part. This is our second brain. And so I'll let you take it from there. Like, what's
Mhm.
going on here?
Well, it's interesting because, the microbiome right now is very sexy in the medical research. Like there's a lot now in the literature about this. And we understand so much more than we did back when I was diagnosed. We know there are 100 trillion microscopic organisms that make up our microbiome. They make up 5 pounds of our body weight. They outnumber the regular cells, the other cells in our body by 10 to 1. So actually, we're not in charge. They are. I remember in a medical conference sitting back and going, is anyone else getting this? Like, we are not in charge. If they outnumber us 10 to 1 and they have so much impact on the way that we think, and brain function, adrenal function, hormone function, immune system regulation, 60 to 80%, is regulated of your immune system by your microbiome. We're definitely not in charge. And that really came home to me as I sat there and watched that research get revealed, right?
Mm.
So we do know we have three nervous systems. Like we have the central nervous system, we have our cardiovascular, and we have an enteric nervous system that innervates our digestive tract. So when we have early, and this is what my study in 2013, the Healing Unresolved Trauma study was revealing, was when we have an early hurt, and everybody in that's a human has trauma. I just want to kind of lay that out as a groundwork. So as we continue to speak, we can have like agreed upon terms. So trauma is any event in your life where you experienced it and didn't have the skills to navigate it in that moment. It was overwhelming. So that can be, I remember I was very traumatized when I went to college my first quarter and I got a D on a chemistry test. I was so traumatized, right? It was like I was used to being a straight A student. And so, and thought, okay, there's got to be a different way of studying here in the big leagues. And so, that was very traumatizing to me. And to another person, it might just be like, oh, okay. So, what we consider overwhelming and traumatizing may be different for another person, right? So, each person is very, very different about how they perceive. So, trauma we can think of as in capital T and lowercase t. So, capital T trauma is going to be the stuff from the Adverse Childhood Experiences study that was done between 1995 and 1997 by Kaiser Permanente and the Centers for Disease Control. This is a great big study, right, that looked at before the Kaiser enrollees, before the age of 18 years old, did you experience these big capital T traumas? And they're the ones that we tend to think of, like in my story, sexual abuse, physical abuse, domestic violence of a parent, having a parent incarcerated, addicted to a substance, die, divorce, like
Mhm.
these are big capital T traumas, psychological, emotional abuse, abandonment, and neglect. So those are the ones when people hear the word trauma, they'll often, if they didn't experience those, kind of like shut out the rest of any kind of sentence, like, oh, I had a really good childhood. And the answer to that for me is good. I am so glad. And you did experience trauma because the lowercase t trauma is the stuff that we go through as a matter of course in humanity, where you have a loss of innocence to attain wisdom, right? And you have to go through this process as you grow up. The loss of innocence always happens through a series of heartbreaks, betrayals, trauma, right? Hurts of some kind. And it's the development from there of our false self, our ego. And if we get stuck there and we get mired down in the story of our trauma, capital T or lowercase t trauma, then we get a lot of resentment and bitterness. And I always say, like, that hot tub that your cells bathe in is primed for disease. So, this is where our microbiome comes in. When you have some sort of experience in childhood that is something you don't it was unrecognizable to your memory banks, you don't have anyone there to help you navigate it, and like it could be you didn't get the part you were auditioning for in the school play, or didn't get picked for the ball team that you wanted to, just you name it, right? Things didn't go the way that you were expecting, and it's an overwhelming feeling. You'll get the feeling in your body first, and then you're going to have a nervous system activation. We always call it the sympathetic nervous system arousal of fight, flight, freeze, or faint. But in childhood, it's not those things. It's just freeze. Okay.
Mhm.
Because we're not autonomous, powerful beings. So it just freezes in space, right? In your body. And then you're going to instantly make up a meaning to attach to whatever that experience just was. Okay. And from that meaning creates a lifelong held belief, and you will create an adaptive behavior to match it. And I'm going to show you what I mean by this. From that, right, that feeling that goes through your body, that's an activation of that nervous system, including your enteric nervous system. We know from research now that what you're born with in terms of your microbiome not only shapes you, but you shape it. It's a bidirectional conversation. Okay. It's not what we used to think was you're just born with the microbiome you have. Oh, poor C-section babies, they don't have a good microbiome. And that's true. And it shapes us and we shape it. It goes back and forth. We have this crosstalk, right? So while we're going through these different experiences of pain and heartbreak, and unmet expectations that create sadness and anger and fear and jealousy and, hurt, then those get stored in the body, frozen, and then they become buttons that people can come along and push for the rest of your life. And there you go.
Right.
You're off to the races again, right? A zebra being chased by a lion, and you think you're about to get eaten for dinner. And when that zebra is being chased by the lion, digestive system shuts down, right? The hormones that are responsible for you feeling good in your body, reproducing, those also get co-opted to make stress hormones like cortisol. So you get your testosterone stolen, you get your progesterone stolen, because survival always wins over reproduction. And
Right.
so this is how this impacts forever your microbiome, your gut health. And so stored, frozen feelings of fear or anger or hurt, pain, oftentimes it's in your belly when you think about it, like we tense in our belly and our core, right? So when I'm working with people on reversing their autoimmunity, yes, what's in the microbiome is so important, and mapping it, the terrain's important. And the thing that I'm after is, what is the perception that you have of yourself in your world that's activating the whole thing, right? This perception, people, like, the brain's really sexy right now too. Everyone's so into the brain and the nervous system. The vagal nerve, right? The vagus nerve is really up in front now. And that's really wonderful, because it is the limbic system activation that we're talking about right now. But it's a little bit like, you know, there's a tsunami already in place when you're deactivating that. What if we can prevent your perceptions from activating that whole thing? That's where the healing is that I do with people, like changing your perceptions about whatever it is that's got you going to the races.
Wow. Lots,
That's a
lots to
lot.
unpack. I love it's it's fascinating, and thank you. As you were speaking, and it was a while ago, but one of the thoughts that came to mind was a stat that I heard recently. And I think, and you would definitely agree to this. A lot of traumas we either tuck away and forget. Somehow we tuck that away, so it's not something that we're so aware of. But it seems that there are some stats that are starting to show that these are now being they're brought to the surface much more now than they ever have been, in terms of being able to discuss them and treat them.
Mhm.
Now, I heard a stat, now correct me please, but it's 1 in 6 are suffering from the big T traumas. Is
Yeah.
that right? Would you
It's
say
actually
that's
one in
about accurate?
four.
1 in 4. And like, think about that for a moment. And
Yeah, 25%. And that's only reported.
that's my point, is 25% of people are not talking about this. I don't know, but I'm sure in your practice it's different, because this is
It
what
is.
you focus on. But I think the majority of doctors out there right now, I think we really need to be aware of that with our patient
Mhm.
base. Because I mean, if I've got 1 in 4 patients and I see 20 patients in a day, there's going to be some trauma in there, whether they've brought that to my attention or not. And it's up to us as practitioners and healers to make sure that we're helping facilitate that healing,
Yes.
and creating that. But that's what the tools that you are teaching people right now, practitioners included. And
Yes.
so it's fascinating. Another thing that came to mind as you were speaking is, when you're talking about the microbiome, and again, I'd love for you to expand on this. I've also seen in the literature that a traumatic event, whether it's big T, small t, whatever we want to describe it as, can actually change your microbiome in less than 24 hours.
Yeah.
And this was also fascinating to me, because what happens if that trauma is happening over and over
Mhm.
and over and over again? We don't get ahead. And, I know this is a gut summit, but this is really an optimal health summit, because we
Mhm.
really need to have our gut in place to achieve optimal health. So that microbiome is just so fascinating, how it can be impacted. So I'd love to hear, if there's any strategies that you've seen to buffer the assault on our microbiome.
It's really interesting, because that statistic is a very important one. And your cardiovascular, your heart muscle also remodels within 24 hours. So you think about these two centers, two of our nervous system centers, enteric and cardiovascular system, remodeling within 24 hours, like that. This is our new normal,
Crazy.
right?
Yeah.
And so the good news is, that I'm going to say, is that you can also get it to switch off again, right? That's important. So yes, what we're saying is true. It happens that quickly. And with conscious attention of really reestablishing a connection to, I always tell people, if you have survival issues, if you really believe that you aren't going to survive. So it may be that you're financially stressed, you're stressed inside your relationship, you're stressed inside of your work, but it's activating this primal root, I'm not going to survive. That has to be healed before anything else can, because your microbiome follows. And so does your brain. So we just mentioned gut, we mentioned heart, but also this happens in the brain. These little microglia come out and they start carving away brain tissue that is not necessary
Hmm.
for anything else but survival. So if you have survival wounding, and this will happen like between 0 and 6 months of age, it'll happen when you make up a meaning that says, I'm not going to survive. I mentioned in the hurt model, the trajectory of what happens. Well, then that adaptive behavior that you put in place. So there was a man that is a software engineer in my area, had a high pressure job. He was in his 40s and he came to see me and he had hyperhidrosis. So he was sweating out his shirts and just like dripping in front of people when he had to present his work in groups, right? And in the Seattle area, we have a lot of tech firms that are quite famous. So he had a high visibility job, and he came to me because he had been on beta blockers, he'd been on anti-anxiety medications, he'd been Botoxed in his armpits, like all the things that we do for somebody with hyperhidrosis in the Western model. So when he came to me, I knew he'd already been through all of those things. And so I started asking him questions, and it came out that in his adaptive behavior response to a trauma in childhood and middle school, he was going against it in his adulthood. And those two things were creating a great big conflict inside of him. And he physically couldn't manage it. So in middle school, in the lunchroom, he had tripped and dropped his metal tray, and food had flown everywhere. And he'd been walking past the table with the cool girls and the girl that he had a crush on, and the whole cafeteria erupted in laughter, as you can all go back to middle school and see the scene, right?
We've all been there.
We've all been there. It's like I think Dante left it out on the Rings of Hell. It was middle school, right? And so he, in that moment, went through this fear, shame. It got frozen in his gut, in his heart. He felt like constricted and stopped. And in that moment, he made up a meaning. I'm an idiot. I'm clumsy. I can't be trusted in front of groups of people. And his adaptive behavior to match that meaning was to never walk in a cafeteria again. And he got through graduate school level education, never going in another cafeteria to go to the library. And so he's a highly successful, very intelligent person. And his 12-year-old self was screaming that the adaptive behavior that had kept them safe was not being adhered to. And he had to get up in front of a group of peers and present his work. So that's who was in front of the group at that point, would be a 12-year-old version of himself, sweating profusely. Okay. It's not safe to be in front of people. So when we healed that, guess what? No more hyperhidrosis. So
Wow.
these are the kinds of things, like if you track my hurt, in fifth grade, the intercom going off in the corner of the classroom, right? And every single time it went off, and it could be like to get up and say the Pledge of Allegiance to the flag, for the secretary to make announcements, right? But every time I was Pavlov's dog, I would go into like complete freeze state, like a panicked rabbit. And so that would then activate of course, my microbiome was set on I'm not going to survive. So the meaning I had created out of my trauma was, because I was being told it was because I was a bad kid by this vice principal, that I'm not going to survive this whole thing unless I'm perfect. So my adaptive behavior was perfectionism, and I was pretty perfect at being perfect until I got sick. So that's an untenable way of living life. Most of our adaptive behavior responses they become maladaptive when we move into adulthood. When we move into adulthood, we now have a brain that has a prefrontal cortex fully formed. Now we can go back to our childhood moments, We don't have to relive our trauma, but we can unpack, like, what are these behaviors that I do? Right. And who needs to be healed and re-educated about something? What needs to be reframed? People always worry that a lot of people that have been traumatized don't remember anything about their childhood. And so we don't have to do it that way. We can reverse engineer. So the whole healing of trauma thing, it has a lot of fear around it for people. Like, oh, I'm going to have to relive this, or I have to think about this, or I put this away. And just as you said, it will come out sideways. You get sick, you have relationship issues, something will happen that's not alignment with your work needs, just like this man, and to be quite honest, for him, it was a fairly simple fix, right?
Hmm.
Go back, pick that 12-year-old up off the floor, dust him off, right? Let him know that everyone in the cafeteria that's laughing is only laughing because they're nervous and are like flipping happy that that wasn't them. It's just like nervous laughter because they can see the embarrassment and they're so glad that's not them. It's not really about him, right? And so you get to really calm that guy down, teach him, like, sometimes you're going to make a fool out of yourself and it doesn't mean anything about your worth, right? So is everyone else in here. And so, he was able to do that in just a really short time. It took a while. Like, if I had a police car behind me with lights on when I was in my 20s, I freaked out. So people in authority, especially men in authority, were big triggers for me. TSA, like, you name it. I did not do well. I would start to get into panicked rabbit. It was like it was a 10-year-old going through whatever experience. And so those moments don't require you to go back and relive your trauma, but they do heal your microbiome. They heal your gut when you fix them, when you reframe them and get the secure attachment to yourself instead of waiting for everybody else out here to make it right for you. It's learning how to do that for yourself.
I think you've touched on it, but what's the main first step to heal this childhood trauma? Like, let's if we could unpack that a little further.
Yeah. Everyone's so different. So Suzanne Cook-Gruder did this amazing research back in the 1970s out of Harvard, and she said there are these ego developmental stages for adults. Well, there's a news flash. Erickson told us, like, there are developmental stages, but when we get to the end, it's generativity versus regret. But most of them are focused on childhood. You have to get your speech, you have to tie your shoes, you have to play well with others, right? You have to potty train. And then when you're 18, you're cooked, you can go away and all is well. But actually, that's not accurate. And so we have stages of development that we're supposed to hit. And we move out of concrete, black and white, blaming and shaming into a more unitive consciousness state where we understand that we are fully engaged in the field of energy that we all contribute to. And we take full responsibility for our very thoughts, right? And so that's a developmental stage and state. So when I'm working with people, I am ascertaining where they are in there. Okay. So there's where it's so individual. Like, my book on solving autoimmunity is called Solving the Autoimmune Puzzle, because we're all so different. We have different genetics, we have a different microbiome from each other, we have different toxic load, and we have different traumatic events and meanings we attach to them. So the first thing that I can say that's really, really important, that everybody, no matter what state and stage of development you're in, is to start to develop what's called often in Eastern philosophy awake awareness, where you begin to stay awake to your own thoughts. So in Eastern philosophy, it said that to have one perception, like if I look at your shirt and I say, that's a really beautiful shade of lavender, I just perceived a color. It took me 17 steps to make that opinion, right? To call it out as lavender in the way that my eyes see it. 17. And so the way that they say it is, how you have perceived things is how you will always perceive them, because it's your patterning, which is the thing I went through before, right? That's your nervous system that
Mhm.
you set up. It's your meanings, it's your beliefs, it's your adaptive, now maladaptive behaviors. They say that if you'll go through to the eighth step of those 17, it's called the gateway to karma. And you create a little gap between stimulus and reaction. So now it's stimulus and skillful responding. You can actually change your perceptions. It takes quite a bit of effort and
Fascinating.
constant observation of your own thoughts. And so, an exercise that you can do is during your waking hours, just for one day, let's try it for one day to start with. Start observing your own thoughts. Stay really awake to them. Set a little alarm on your phone, a little ding that reminds you every 30 minutes, come back to your thoughts, observe them. Notice the tone that you speak to yourself and others in. Notice the content. I don't know who measures this, but apparently 94% of our thoughts are recycled. We've had them over and over and over and over again. Notice what your themes are. What are you ruminating about? And then see, is it life supportive or is it kind of like life destructive, dismissive, divisive, harsh, right?
Right.
So notice that because actually the bugs in your gut are going to match that. The more reactive your mind is, the more reactive your body is. So if you'll start to do that, you can even put a little kinesthetic uh, practice with this. Kind of take notes about your thoughts for that one day, and then have a little bag of light pebbles that you've gathered and a little bag of dark pebbles. And at the end of your day, sit down, whether on the floor, at your dining room table, or at your bed. And for every life supportive thought you've had, put a light pebble in front of you. And for every more like kind of negative, life destructive sort of thought you had, divisive, harsh, demeaning, put it in there. And then for most people that haven't developed that constant state of awareness of themselves, that are really focused on what everybody else is thinking and doing, the government, whatever it is, right? Their spouse, their children, their mom, their dad, their boss, their colleagues, then you'll start to see that there are more dark pebbles in there, the less awareness that you have. The next day, if you're willing, do this for a week. When you notice your thought, you'll be less likely to let it go into a whole loop.
Hmm.
So, a lot of people make an assumption that they're kind of like on the couch watching a monitor of their thoughts and they're very passive. Like, whatever my thought is somehow fabulous and true, which is not the case. And that I just am a passive observer of whatever my thought processes are doing. And that's also untrue. You can change the channel if you're not happy with your thought process. And so you get to question the validity of your thoughts. You get to look at them from an adult perspective. Notice that some of them might be quite childish, still blaming, still shaming, right? Still held on to these adaptive behaviors that your really smart child self decided in a moment of pain and survived on that really well. Okay, so these are not bad things. It's just you've outgrown them. So then, if you start seeing one of those little negative thoughts pop up, you'll go, I don't want to put a dark pebble in there. So I'm going to shift that. I'm going to think about the hummingbird feeder that I saw yesterday and the flowers that are coming out in the spring and the breeze and, oh, the sun is shining. You can actually replace your thoughts with something else that's more life affirming, right? And then you get to put a white pebble in there. And so the more of this awake awareness that you start to establish, the more you start doing one of the developmental tasks that most people move into adulthood having not checked off. In adolescence, you are supposed to have attained the check mark, developmental task completed, of moving what's called your locus of control from external, where your teachers, the clergy, your parents are telling you how to be an adult and imparting their value system on you, so you have a guidepost, to making that a locus of control that's internal now. You are self responsible, and you're supposed to do that in adolescence. A lot of people die still not having done that. They're still blaming everything around them for what their unhappiness is. And
Any
so
reason
while
why?
you're observing, you're being able to do that developmental task.
Do you see any patterns as to why that's happening more in adolescence? Is it more now, or is it just because we're more aware?
Well, in adolescence, it's supposed to happen, but it hasn't been happening.
Mm,
And there is a research duo from two universities that did some research on their various campuses. They wrote a book called The Narcissism Epidemic. And they said that the locus of control being stuck on external and not being internalized has four different root causes. And it's been narcissism has been going up since the late 60s, and it's peaked so high right now. And what they identify is social media. So kids are really, really wanting to be famous, YouTube famous, Instagram famous, right? And that's actually creating, again, focus is external. So now celebrities are the ones that influencers, right? So
mhm.
now the locus of control is still externalized. Material, so banks giving easy loans, that was another problem, so that you could live the lifestyle of the rich and famous, even though it wasn't within your means. So that's another external looking around and trying to keep up with the Joneses, right?
Mhm.
Another one is the self esteem programs that have been put in school systems in North
Sure.
America, where everybody's a snowflake and everyone gets a trophy. And, we don't want to hurt anyone's feelings. And so kids don't get that opportunity to be disappointed and learn skills to manage it. Because let's face it, life doesn't provide you everything that you want. So this instant gratification is another externalized foci. And so these are some of the things that have got everybody stuck, and
Mhm.
why this narcissism's gone up, and why we're not creating like a good self-awareness for ourselves. Our sense of worth is being based on external things that are fundamentally impermanent, right? Like looks, impermanent. Money, impermanent.
Absolutely.
So yeah.
I'd be curious to know, just to kind of come back a bit more full circle here. Do you see any patterns when you're assessing somebody, with from gut issues? Again, just to discuss, a lot of people listening today have got chronic gut issues, but do you see any typical types of digestive issues that would ring potential alarm or awareness bells, we should say, of that underlying trauma that should be explored and resolved ultimately? Is there any, I'm sure we could probably make the argument to almost any digestive condition, but are
Mhm.
there some frequent flyers that you see out there particularly that would ring that bell?
All of them, because really,
Yeah.
ultimately, what we're talking about when we perceive ourselves as not okay, in danger, not going to survive, not good enough, not fast enough, not beautiful enough, not rich, whatever it is of the enoughs, then we're sending a specific message from the brain and neurotransmitters, hormones, which are the messenger chemicals. And we're activating adrenal glands to release cortisol so that we're zebra being chased by lion. So that's going to it hammers away at the gut wall, create leaky gut. So any of the downstream complications of leaky gut, which is all of them, are going to be in that category, right? Because whatever we're perceiving as being not okay, our expectations haven't been met, then we're activating our nervous system response. So it's that comes with candida, parasites, SIBO, all of it, ileocecal valve syndrome, like IBS, constipation. And the thing that I tell people, food sensitivities, the whole bit is that when we're really healing those things, food is about 25% of the solution, supplements are about 25%, and how you perceive is 50%. And you have to do all of them. You can't just say, well, I'll just
Totally.
work on my thoughts. That doesn't work, because now you have leaky gut and there's a physical problem manifesting. So
Yeah.
you do have to fix your microbiome, and it can't just be done by thoughts, changing your perception. So you have to do all of it.
Yeah, a table needs four legs to stand up properly.
Exactly.
You can't take, one or two legs away and expect everything to be in a proper environment to
And
heal.
most of my patients that come to me are kind of mad. They're angry because the four-legged table hasn't been addressed.
Mm-hmm.
They've spent so much money on supplements and dietary protocols in the functional medicine world, and that trauma piece hasn't been
Right.
really addressed. And so then when I say you still have to do all those things, we have to retest because this test is a year old and remember, remodels within 24 hours. So we have to see what's going on. They're
Yeah.
like, "Ah," and I always tell people any protocol that you've done, any testing that you've done with somebody, it's not wasted. It's been information that you have gleaned about yourself. This is really important. That's still in that blaming thing. Oh, the medical model has let me down. Well, it's educated you in some way, right? You've learned something. So you move
You're
on from
building on
there.
it. Yeah.
You're
Each
building on
time.
it.
But
Exactly.
but I imagine, one of the analogies we could say is if you don't have your trauma resolved or you have unresolved trauma, it's almost like having that thumbtack at the bottom of your foot and
Yes.
just putting band-aids on it and expecting it to get better. You're just taking Tylenols and expecting the pain to go away. We still have to come back to that.
Right.
And this is where, peeling the layers off in all directions are going to give you that vitality to improve. But if you don't get to that 50% of what you're saying,
Yeah.
I mean, we're just not going to get ahead.
Yeah. It's so
Well,
accurate.
this is so fascinating, Dr. Keesha. I mean, I'd love to obviously chat all day about this, but are there any other pieces that you would say from, a child trauma gut connection that are vital for people to hear today?
Yeah, just the piece around leaky gut and what we described, like how that gets hammered away at from the way that you perceptions set everything off, is to move outside of the blaming and shaming paradigm, that concrete structured child way of thinking. And sometimes people will hear, so you're saying that my autoimmunity is my fault, or um my doctor said it was also because it's in my mind, and people are really upset by that idea that it's all in your mind, and it is all in your mind. So that's what's so important to realize is our mind, our mental state stores all of this information from before and then influences the physical body. So this idea that we've tried to separate them and only focus on the body and have little brains dragging the body behind, it doesn't work. And the body has so much wisdom. And whatever you developed as far as patterning goes from childhood, as I said earlier, was the smartest thing your child self could come up with. And it was so wise. And so that little child part of you deserves this gigantic hug because they helped you
Mhm.
survive. And you have a skill set now from those adaptive behaviors. Nobody wants a medical provider that's anything less than a perfectionist. But my children didn't want a perfectionist raising them, right? And so you get to learn how to be in charge of your skill set rather than having it run you. You don't want to hand your keys of your life over to an upset 4-year-old and have that one be always in charge. So this is an important part of attaining wisdom as an adult.
Beautifully said. And you put a smile on my face. I just envisioned my 2.5-year-old having the keys.
Right? It's like, no, honey,
Oh,
yeah, I want you to be able to play, not do this.
yeah.
It's too complex, right? Our child selves were not complex thinkers because they didn't have the brains for it. They weren't developed
Yeah.
for it. And so it's really important that we really securely attach to them, engage with them, help them heal with compassion,
Mhm.
and put aside our harsh judge and critic and then take over.
Well, thank you for sharing not only your story, but your wisdom. And this is going to be very helpful to many people listening. Where can we learn more about you, Dr. Keesha? Where can people find you?
A good place to start is my book, Solving the Autoimmune Puzzle, and then my website is drkeesha.com.
Well, great. Thank you for all that you do. And thank you again for joining us today. Take
Thank you.
care.
I appreciate the work you're doing.
Thank you.
Bye, everybody.